My journey through medicine really began many years ago in Canada. I lived in Edmonton, Alberta. I did my undergraduate at the University of Alberta, but at the same time, I was an orderly in the operating room. Back then, I was tasked with kind of turning over the rooms, supplying it, moving patients, wiping it down, mopping the floor, basically the bottom level in terms of patient care. I didn't really interact with patients directly. But between cases, I would witness and observe the surgery. I always had an interest in surgery since I was a kid. And I remember distinctly seeing these big surgeries where people were reconstructing the face, like a jaw after a cancer removal. And I remember that was the coolest thing that I'd ever seen. So I set out with a very specific goal. I wanted to be a surgeon, but not just any surgeon, a surgeon that really makes meaningful changes in people's lives. I got into medical school, did my residency training at Mount Sinai, and then after that I went on to do a plastics fellowship at Baylor in Texas. Through all of that, I kind of focused my attention on getting back to those surgeries that I saw, reconstructing people's jaws, but reconstructing people's faces and ultimately reconstructing people's lives. It wasn't just about reconstruction. You can change a person's life from an aesthetic and a cosmetic stance. My practice prides itself on understanding patients. I really take the time to really cultivate a relationship with my patients to understand what it is that they want, but why. If you understand the why, you can understand how best to serve that patient. Throughout that journey, I've done a lot of philanthropy work, cleft lip and cleft palate work. I've been to Peru, multiple mission trips. That's where I recenter myself. Being a physician, it kind of gets a little crazy. You know, your practice is busy, you're dealing with a lot of different things from a business standpoint, but ultimately you always have to center yourself and restore that understanding of why you do what you do. It's funny, when you go on a mission trip, it's the hardest work that I think I've ever done, and it's also the most rewarding, and I enjoy it the most. When you see that kid on post-op day one, where they can smile and the moms and dads are crying and holding the baby, it really re-energizes you, and it also recenters you so that when you do come back to your practice, that you get back to that patient relationship and why you do what you do.